Hello and welcome. You're with IndiaPostLive.com, India's first live interactive web television. This is your own platform where you can engage with us and talk about various issues that we talk about. If you want to, if you have your own issues that you want to talk about, please write in to us, post in your comments on www.IndiaPostLive.com. Of course, you can also send us your audio and video comments on the topics that we talk about. You can send us your tweets. We will read them out during the show, during the conversation at #IndiaPostLive and @IndiaPostLive. So this is your own very platform, and this is the beginning of a new week. It's Monday, and as you're all aware, Monday is the day we focus on entrepreneurs. Well, this entrepreneur, this venture that I'm going to talk about now is very similar in a few ways to IndiaPostLive.com. They are called doctorscabin.com, and in fact, they are only 3 years old, but they are already very successful as consumer-focused health innovators, and they are a digital platform where people can take control over their own health, and they can decide the best course of treatment, the best doctor for them, the best hospital for them, all thanks to the efforts of doctorscabin.com. So we're going to hear more about that. We're going to exactly try and understand what they do and how they came up with this brilliant idea in an age of new age technology in the digital era, you know, how the amalgamation of medical treatment and digital space came together. We're going to talk about all that. Joining me in the studio is Rajesh Joshi. Rajesh is director, one of the directors of doctorscabin.com.
Right.
Hi, and welcome to the conversation.
Thank you for having me.
Also, we are joined online by Mini Balaraman, Mini and Prakash. In fact, they are presidents of doctorscabin.com. Mini, welcome to India Post Live. Can you hear me?
Yes, I can hear you. Hi.
Hi. Thank you so much for joining the conversation. We are going to understand what you all are about. And of course, we also have Dr. G.S. Nair. He is Chief Medical Advisor of doctorscabin.com, and also he runs various clinics in Bangalore and Kerala. Dr. Nair, thank you so much for joining the conversation.
Hi, good afternoon, and thanks a lot.
Hi, good afternoon. Good afternoon. All right, first let me talk to Rajesh, and let's try and understand how exactly this idea of doctorscabin.com came about. You are not from India. You've not lived in India many years, have you?
I was actually born and raised in Canada.
Okay.
So two of the 4 co-founders
Right.
were raised in Canada, and 2 of us were raised in India.
Okay.
And we all had this common experience of being in North America, Canada and US, coming back to India. And I think it happens to many people when they come back to India and they go to a city that they're not from, so not their native place, not their place of origin, they're really at a loss in terms of healthcare, which traditionally is done by calling up somebody you know or your family's known for a long time.
Yes.
So we came back, we were technology oriented, and we wanted to find and access, good doctors, top specialists, and where did we start? So we thought, let's build it. Let's start aggregating the data, and let's create a service that can really help people find and really connect with the healthcare providers that they need.
Did you not think, I mean, I'm asking because, again, we on India Post Live, as you know, we're doing something very similar. We are also a digital space where we engage, we interact. But you started this 3 years back. Now, did you not think it's too early for something like this?
It's funny you asked that. I mean, as with all entrepreneurs, at the time they're probably overly enthusiastic. You couldn't be an entrepreneur otherwise.
Right.
So you just have a good idea and you get out there and you get it into the market and you start building. So if we hadn't started back then, we wouldn't be in the position now with the data set that we have to really be leading the market. So we've been assiduously building connections with hospitals, doctors, indexing the procedures, getting indexed in turn by Google and all these search engines. So a little bit early, maybe, but it takes time to learn. So
all right. Let me just talk to Mini now. Mini, Rajesh has been saying that they wouldn't be where they are today if they hadn't started out that early. But what was the whole experience like for you? You are also not from India originally, are you? In terms of you've not lived here too long.
Yes, me and my husband Prakash and our kids were in USA for over a decade,
Right.
and we worked there for quite some time. And then we were moving back to India. And when we came back to India, we were looking for actually a pediatrician for our kids, and we really didn't know who to see and who was a good pediatrician out there.
Right.
And we found that there's a need for such a service in India, and that people here in India as well could use like a booking facility or video chat service. These type of services are really needed in the healthcare sector in India. That's why we came up with this idea to start this, and that's how it started.
All right. Where did you raise the initial capital? I mean, I have to ask an entrepreneur that question. It's always about the initial capital, right? Where did that come from, and how did you? What did it take for you to do?
So it was basically internally our own funding.
Okay.
Just our initial investment was from our own pockets, basically.
Mm-hmm. So you registered a domain, right? You had to register a domain called doctorscabin.com, and then.
Yes.
Did you get help people to index it, as you said, basically create a database of doctors and physicians and hospitals and...
If it comes right down to it, Minnie and Prakash are the real core of the operation, and
Right.
Prakash used to be with eBay.
Okay.
So it's really his domain.
So the e-commerce angle was taken care of.
Yeah, a little bit of our secret sauce is really in his head, and in Minnie's as well.
Right, all right. Okay, Dr. Nair, if I can just ask you, as Rajesh himself was pointing out, we tend to depend on our family doctor, our family physician. We all have the family doctor. The whole family calls up for anything, And so this kind of a venture, to go on the net and search for specialists and search for doctors, that must have been quite a new concept. So how do you think people warmed up to the idea? What did you do to ensure that?
In fact, I started on this quite some time back,
Uh-huh.
and I was serving the Indian Air Force as a medical consultant
Okay.
and an aerospace medicine consultant, and I've been associated with things like the manned space missions and all that. And so I got into telemedicine, telemetry, all those things quite early in life as part of the ongoing the discussions and other programs with Russia as well as with NASA.
Mm-hmm.
And in the process, I was in the Institute of Aerospace Medicine in Bangalore,
Right.
which was anchoring the entire human space missions for India. And in fact, we were supposed to send a man in Challenger way back in '86. And even at that time, we were talking about these as a routine. And you'll be surprised to know that telemedicine we had experimented way back in the '70s, where a doctor engineer from the Indian Institute of Aerospace Medicine could get biotelemetry from a pilot flying a fighter aircraft in Bangalore.
Wow.
So this very much part of it, and I retired or took early retirement from Air Force way back in '99. And 2001, I started a company which was based on IT-based healthcare.
Mm-hmm. Mm-hmm.
So probably that is one of the first in the country, and that had a unit in Trivandrum in 2002 in the Techno Park.
Okay.
And there we actually started with electronic medical records, and not so much of video conferencing because the technology was not so developed. But soon I got into in contact with people. In fact, as you know, the government of India has started initiative on telemedicine quite some time back.
Right.
And I've been part of some of those trials.
I wanted to talk to you about that. Thank you so much. You raised it up. The Sky Medical Centers, the Sky Medical Center that basically to cater to the rural part of India that the government of India has started. That also apparently is doing well, is it not? So are you getting any support from the government in this, or is it just entirely your own?
No. On the other hand, actually, I got an order to set up telemedicine centers between the regional cancer centers and the district hospitals in few states. In fact, Karnataka, we have set up this between the Kidwai Hospital and Mandya Hospital.
Right.
So it was supposed to be in a number of states, but somehow it hasn't picked up that well. But so we were in that, but in the meantime, I started using it in my own company to use the technologies. And that's where I met Doctor's Cabin sometime,
Right.
Liver Center in Trivandrum, so
Right.
we are co-located. So we've been sort of trying this for the last, I think, couple of years plus.
Yeah.
And also have association with a few other people who are in the same
Great.
area.
All right.
We are
Rajesh, let me get back to you.
The main difference,
Yes.
what the government of India started, I think with the help of Apollo and ISRO, was quite technology heavy, because that's where the technology was at that point in time, and thus expensive. So they could only go so far out. So what's changed between then and now is that with the advent of mobile phones, smartphones, etc., we're able to go a lot further, and with tablets
Right.
are and will soon be able to go all the way out.
Okay.
And per the government's initiatives.
Yes.
We're really hoping that
Yeah.
goes not just
now
to
that even 4G is about to come.
well, exactly, and not just the 200 million odd people who are internet connected, but we've got to figure out how to get the other billion at the base
Exactly.
of pyramid involved and accessing top
right.
specialists without physically having to go to Bangalore and physically having to come to Delhi.
Right. Let me understand Doctor's Cabin a bit more clearly.
Sure.
What are the facilities? What are the services you offer?
Right. So we positioned ourselves as a one-stop digital health shop. If that,
One-stop digital health shop. Okay, great.
DoctorsCabin.com. That's our little pitch.
All right. All right.
And what does that mean? It means that we are a digital health platform that takes the user, they log in, they register, and then they're able to gain information for their own self sort of diagnosis and self education, and then choose from the health service providers that they'd like to interact with. And they do that in three main ways. The first one is the traditional appointment booking. So we facilitate them booking an in-person appointment at over 2,000 of our hospitals and clinics across the country.
And how are you tied up with them? On what basis?
We've, over the years, that's why everything takes time, right? So we've tied up with these, about I think 70 or 80% of the top national brands, and then also smaller clinics, and not just in the first tier cities, not only in the big metros, but also second and third tier cities. And we're constantly growing that network to make it more and more accessible. So we facilitate the in-person experience, and then if the patient, the customer, would like more convenience, then they can access our video chat facility.
The video chat
That's right.
facility. All right. All right. So what happens in the video chat facility?
They basically log in, and then they're able to select from a wide range of doctors, both in India and abroad.
All right, let's try and take a look at that coming up on your screen now. The do's and the hows of the video chat. Yeah, please take us through that, Rajesh.
Oh,
Yeah.
I think it's sort of self-explanatory.
No. We still want more information.
Okay, so you log in, and
Okay.
you're able to see both who's live and available,
Okay.
at the moment,
All right.
or search by specialty or by geography.
All right.
Generally, if it's video, you don't really care about
There
geography.
is a huge difference in a rate per minute. There was one which
That's
said
right.
60 rupees
right.
per minute. This is
That's right.
24.
So our approach is to be information-driven and
Okay.
an open, transparent platform.
Right.
So what we're trying to do here is put the information in front of the user
Okay.
and let them decide as much as possible.
Okay.
So it really is up to the doctor or the hospital and the doctor together to decide what rate they would like to bill at. And it tends to range from 20 rupees a minute to 200 rupees a minute.
And who decides that? The doctors themselves.
The doctors and
hospitals
hospitals in
themselves.
consultation.
Okay.
So we're the channel that helps these basically interests align.
Okay.
And in the
So there is a bit of a rev share happening there. Is it a revenue share
That's right.
happening
That's
with the
model.
hospital?
That's the model.
That's the model. The
Yes.
revenue model is
Yeah,
a
so
revenue
we're,
share.
we're providing the channel.
Okay.
They use the channel.
Okay.
And but they set the rates. It's really up to them to decide. And what we're hoping moving forward is that there'll be able to be a differential facility for rural outreach, whereby they could maybe cross-subsidize or choose to do something like that. So that, as in many other.
But this video, okay, please go on. I'll ask you
Right.
I'll remember my question.
And the one thing that's a little bit different that you might have noticed is this per minute concept.
Yes,
Because up till now,
yes.
people don't think of doctor interactions like that. So the incentive, if you go into a doctor, especially in a place like Delhi, where everything is incredibly busy
Yeah.
and under pressure and,
Yeah.
and getting quite expensive, is that the doctor minimizes their interaction time, whereas the patient wants to extend it. So in going along with transparency.
But does that leave the patient satisfied? I mean,
Well, yeah, because you can use as much or as little time as you want. So in many ways, it goes back to HLL's concept of unit pricing. So if you want a small, like rather than just buying 10 minutes with a doctor, 15 minutes, if you only need a few minutes to clarify something over breakfast, your child has a runny nose, rather than wasting half a day going to the hospital, getting stuck in traffic, paying for the petrol, having other people's kids cough on you and your kids, you can just sit there over breakfast, have a few minutes,
okay.
and solve your problem.
But this is a consultative thing, so this
Yes.
would obviously mean a post it's like a consultation after you've done the tests, perhaps, and you're reading out the test results?
That's a common usage. So commonly people will use it for follow-up. So they'll go in,
Follow-up, right.
they'll physically see the doctor with the first feature, then they'll load up their blood tests and labs and everything like that.
Right.
And then for follow-up, curiosity and consultation,
All right.
they'll use the video chat, which is far more helpful for the doctor to be able to see the person and interact rather than just a telephone call.
Right. And
they
what
can
else?
also use it for second opinions. So a lot of people are much more informed and have longer term conditions.
Okay.
And they know a lot about their medication and where they're at in their sort of treatment cycle. And then they'll be able to, we found out one interesting statistic out of the UK is that 25% of people misdiagnose themselves on what they call Dr. Google, just Googling or using WebMD, passive information.
Right.
So what we're able to give is active information from a qualified specialist.
For a price.
For a price.
Right. Okay. And also, suppose I'm told that I need to have so and so procedure.
Yes.
I can also do a booking for an operation through your.
That's right. That's a newly launched feature. We've got 30,000 procedures and treatments available. So I don't think you necessarily want a comparison shop for every procedure out there. But there's a wide range of procedures where you can go in and basically look at the different offerings from different service providers, different hospital groups, get a price, and book.
Right.
Continue on.
Okay, Minnie, let me get back to you. Minnie, how did you advertise? How did you let people know that there is this thing called doctorscabin.com, this one-stop,
digital health shop.
Digital health shop.
Yes, we have various ways of advertising currently. Like we have a Facebook page where we have fans.
Okay.
We post our updates in there, and then through other means, just internet marketing kind of things.
Okay.
And as well as our current doctors who are registered with us, they do let their patients know that they're registered for the video chat and other services. So their patients themselves start to use the service. That's how we're getting the word around.
All right. So, as one of the founders and the president of doctorscabin.com, I have to ask you. Rajesh clarified that there are essentially three services. One is, of course, facilitating appointments. Second is video chats for follow-ups, and also second opinions. And the third is booking for procedures.
Okay. Yeah.
What next? I'm sure, as an entrepreneur, you're just not thinking of just continuing with this. What next for health consumers?
So we are having other services like Ask the Doctor, where patients can ask a question via email through our system itself, through doctorscabin.com.
Okay.
They can share their medical files, and if they want to just share their medical files and get an opinion on that, the doctors respond very quickly to the patients. Like within a day's time, they get back to them. That's one of the newer features. As well as we have our health products, which there's thousands of products available on our site, which patients can purchase online. That's one of the newer features coming up. And we're constantly building up the procedure listings of the various hospitals and across India.
Right.
So we're expanding in all different directions.
All right, that's great. Okay, Dr. Nair, let me also ask you, as someone who's been practicing medicine, I just use the word medical consumer instead of a patient.
That's right.
Right?
That's how we look at it.
Yeah,
actually.
yeah.
Because that's what we are.
Yes.
Actually, just before you go to Dr. Nair, two of us, having grown up in Canada, this might not be common knowledge, but Canada is actually one of the few jurisdictions in the world, one of two, where you don't have private health care.
Okay.
So at one level, it's a very fair system for everybody for primary care, for the initial emergencies and things like that. But you wait often 2 and 3 months to see a specialist.
Right.
So what I found, and what Vikram also found, coming to India, is that you're very quickly, if you're in the right position in an urban center, very quickly able to access, anybody, any specialty, for a price, of course, and that's the question that we all have to work on.
Yes.
But we want to actually continue that concept. So the core for us is treating the patient as a consumer and giving them the information and enabling them to make the right decision.
So what I was asking Dr. Nair is, do you see patient behavior or a medical consumer behavior, do you see that changing now? Do you find them more aware, especially the ones who have access to internet?
Yes, in fact, you'll be surprised to know that my company is one which is based on changing the attitudes of both the doctors and the patients.
Right.
In fact, what I'm doing is that since 2001, when we launched the company, we are looking at the IT employees,
Yeah.
So we are in International Technopark in Bangalore, as well as Technopark Trivandrum, and now in Cochin, also in Copa. So we are looking at the young people, particularly the most vulnerable, that is in the 20s to 40s.
Yeah.
You think that you are healthy, but on the other hand, you are subjected to so much of stress, plus pre-existing problems.
I'm sure
So
we are
what
not.
what we are doing is a kind of proactive preventive healthcare.
Okay.
That is purely data management, knowledge
Right.
management. So I'm looking for people like Doctors Cabin and other companies which
Yeah.
are providing this kind of access.
Great.
And today what we are doing is that we are providing similar cover not only to the employees but also to families.
All
So
right.
in Bangalore we have an entire gated community of about 2,000 plus apartments, about 8,000 people who have a dedicated clinic and dedicated teams of doctors around the clock available both to visit in the clinic as well as online. So we
Alright.
provide 24/7, 365 access to a person, and we are not looking only at the people who are sick. We are assuming that all of us are vulnerable to some problem or
Right.
other.
Right.
But it will come only maybe after a year or 5 years or 10 years. But then you could provide, so the basic concept is to bring back the family doctor, and today with technology, he need not actually visit the home. He can be available to you at a drop of a
Great.
coin or
Yeah.
whatever. is it.
Right. Right. So the whole
Yeah.
philosophy of prevention is better than cure, as he said, because the
and
young people also are so vulnerable because of all the stress
The
and
stress of the modern work
Right,
environment.
right.
It's funny you say prevention because actually, to use another UK statistic,
Yeah.
the NHS has openly said that empowering patients is more important as a concept than penicillin. Now, penicillin's been the biggest revolution in a century,
Yes.
and getting empowerment to patients
Right.
enables preventive care and stops the progressive diseases.
Okay, my last question to you before I wrap up this conversation. We talked of doctorscabin.com, and we also talked of the whole Sky Health Center concept of the Government of
That's
India,
right.
which is essentially catering to rural areas
right.
who have access to specialists.
That's right.
Do you see doctorscabin.com also reaching out to the SECC or D of a society, and because how's the payment happens through credit card or net banking, I think. But how many years do you think it'll take doctorscabin.com to reach that strata of society?
I'm glad you asked, and it's interesting that you did ask because it's something that we sort of strategize about. I mean, the point at which that becomes possible. This traditional network only goes out so far. So with tablets and with modern connectivity, we can actually go further than this. And we've got a project actually in the garage that we're working on that's going to be launching soon, in the next few months, that should be able to reach out further and enable other payment mechanisms. So you don't need currently you need a credit card, essentially.
Right. Okay.
We're looking at other methods, and in the same way that people, have been able to pay for prepaid phone cards and
Right.
things like that.
All right. Great.
We'll be able to get out
So
there.
you are, like I said, marrying technology
That's right.
with medical care
That's right.
and reaching out to people. All right, great knowing about you. Mini, thank you so much for joining the conversation. Dr. Nair, thank you so much. It was wonderful to know about this a wonderful, very noble venture that you have started, where you are, like you called it, a one-stop digital medical shop. And thank you so much. It was great having you, and I
Thank you for
hope
having
that more and more people benefit from your endeavor. And for all of you out there, we are all about encouraging entrepreneurship, showcasing entrepreneurs, and encouraging all of you to think out of the box and do something that can be wonderful for society. I'm waiting for your tweets, your posts, your audio and video comments on doctorscabin.com. The conversation continues on doctorslive.com. Thank you so much for watching. Bye-bye.